This podcast is brought to you by the Pacific Neuroscience Institute Foundation. Are you looking to support your memory and optimize your quality of life? Develop a healthy brain for brighter days at PNI's Lifestyle Program, available virtually and in person. Reserve your spot today. Visit pacificlifestyle.org to learn more.
Hello, this is Anthony Effinger. I'm the host of the Think Neuro podcast at the Pacific Neuroscience Institute. And today we're going to be talking about cancer care, and we're going to be talking to two people who have cared for cancer patients and one clinician for whom that's her job. I'm going to ask each of them to introduce themselves and give us a short bio, and then we're going to get into some questions about cancer care. Let's start with Emmeline.
Hi, welcome. Thanks for joining us. My name is Emmeline Moritzen. I'm a physician assistant here at Pacific Neuroscience Institute in Santa Monica. I work with our patients, their families in our clinics, in our infusion center, and when they're hospitalized here at St. John's to help them on their journey, get them medications, and be a resource for them whenever questions come up. Thanks for having us.
Oh, yeah. Thank you for joining us. Elaine.
Hi, I'm Elaine, and I cared for my husband, Stephen Beach, who was diagnosed with a brainstem tumor in 2018, March of 2018. And he died in 2021, in October 2021. And during that time, I cared for him along with my two daughters and caregivers, full-time caregivers. So it was pretty full on. I'm a writer. I worked throughout the whole journey, and it's been a challenging, but also very inspiring and positive journey despite the heartbreak.
Ari.
Hi, my name is Ari Noen. Thank you for having me on. I am a physician in Beverly Hills, and my father was diagnosed with glioblastoma in November of 2019. And much like Elaine, with the help of family, my mother, my sister, full-time caregivers, the excellent care of Dr. Kesri and Dr. Sharma. Thankfully, Dad is still with us, but in a very different way, and we still are fighting the fight and continuing to care for him.
Start with Elaine. I think we all sort of imagine the worst when we think, could this befall us? What to you was the most shocking and surprising thing about giving care for somebody who has cancer?
Well, I have to try and get through this without bursting into tears. Because just going back, I remember when Stephen we got the news, the night that we got the news, I got the news and I was at the ER and they told me that there was a mass on his brain. I fainted, actually. That's what happened. And from then on, it was just a challenge to stay stable and do my best for Stephen, along with the shock of what happened, because he was in his 60s. He was, I know it's easy to idealize people, but he was the rock of our family. He cared for everybody else. That was his job. He was a property manager for a spiritual organization, actually, that we belong to. But he was brilliant at practical, everything practical. He did the DIY, he did the moving, he did the fixing, and the whatever was needed, not only for our community, for our street, for everybody. So the shock was that suddenly I had to care for him and wanted to care for him, and I wasn't very good at it. It kind of felt like it should have been the other way around. And so the biggest surprise for me, the biggest shock was just suddenly that he couldn't do the things he always had done, and that I had to step into that. And that also, I'll tell you another thing at this point in the conversation, my love for him, admiration for him, and devotion grew. There was never a moment where I felt this is too much, or I wish I didn't have to do this. It was a privilege, a great privilege throughout the journey.
Mm. Had he been healthy and, it sounds like he was a, vigorous, never had, if I had to guess, didn't have any health issues before this came about?
Well, exactly. Before this happened, he had always been healthy, fit. He played tennis. He was running around. I mean, he did too much. My only complaint with him, was that we'd be having dinner and he'd go and rescue somebody, like the water heaters broker, or we'd be out for dinner and he'd get a call. Sorry, I had to go, and he put everybody else before himself. However, right before he was diagnosed, for a few months, he'd been complaining that he was shuffling. So Steve didn't have a glioblastoma. He had I think it was a stage 2.5 or 3, maybe they weren't quite sure, glioma, but he hadn't been quite himself. Which I'd ignored. He was more emotional, more affectionate, more. He didn't want to bother me with his problems, but he definitely was more shaky on his feet, and he thought he had Parkinson's. And his doctor didn't do anything, didn't book an appointment with a neurologist, although he'd asked. I honestly, I ignored it because I probably didn't want to know the truth. And I just said, "You're fine." So he carried on working and being okay, right up to the point where he went to the ER. He said, "I don't feel well, I'm going to the ER."
Oh my. Okay.
Yeah.
Ari, same question for you. Most sort of surprising thing about being a caregiver?
The most surprising thing about caring for Dad, there's multiple levels, answers that I could give to that, because I've had to play a lot of different roles and transition between different roles. So as a physician, the very first thing that was surprising and difficult was how little there was actually to treat and to do in the beginning. I immediately went into, hero mode, trying to save Dad as the physician, not as the son, and eventually having to alter that role by finding excellent physicians. So I never thought that when something tragic, traumatic like this would happen, that I'd have to wear so many different hats. Dad is extremely positive, who's still with us, thank God, and he's an extremely positive, fun, loud, center of the family, kind of glue to his entire extended family. To have that kind of light slowly over time be somewhat dimmed and continue to keep happiness in the family, and to try to do some of the things that he would have done, or to try to play some of those roles. Again, that's not something I had anticipated. When there's going to be trauma, when there's going to be difficulties, having to play the doctor role, the helper to my uncle's role, the making sure my mom is okay throughout all this. It's an unanticipated thing that all of a sudden you're doing the job of many. And the other thing that I would comment on is, with something like glioblastoma, it's really difficult, and Dad was the champion of this. He can't speak anymore, but when he could, of keeping hope alive. I didn't think that would be such a challenging thing, but I honestly think that he's made it this far because he's been able to do that throughout it all. And we've been really fortunate to have amazing caregivers, the devotion that Elaine talks about of a wife for a husband. I mean, what I've seen from my mom and sister and extended family has just been incredible. So we've been fortunate, but he's also championed a lot of it. He's toughest guy I've ever seen.
Oh, wow. Emmeline, does this sound familiar?
Yeah, I have a couple of thoughts when you both were speaking about how it feels to be on my side of the table, so to speak. When I tell people what I do, that I'm a neuro-oncology PA, I often get blank stares, or people don't know what to say to me because they don't know how to deal with that. I always find it so surprising because every day I bear witness to such love between family and friends and such hope and strength. At the end of the day, I go home and I think, wow, like we were able to smile through such pain. We were able to make jokes. Our patients and their families are full of humor and life. And I think to not think of that, to think of, such negativity when it comes to this field, truly. And I'm so humbled, and it's been the great privilege of my life to see such love and commitment between friends and family. And I mean that from the bottom of my heart. I every day am just in awe of our caregivers and our patients. And it truly is the great privilege of my career to be here. So it leaves an impact. I think about our patients after they leave. I don't leave my office and then I'm done. I think about you all the time. And that's something that I hope and I want our patients to know, is that we think about you all the time.
Does that resonate with you, Elaine?
Oh my goodness. I'm so sad that I didn't meet you. I feel like I want to get to know you now, and I'm sure we will, because I'd like to do more. That's one of the missions of my life now, to help in any way I can. Which sounds cliche, but it's true. But the staff at P&I at St. John's I can't even describe it. I've had so many laughs with Dr. Kesari, Santosh, when Steve was lying on the bed and he couldn't talk and he was on oxygen and he could just stick his tongue out, where we've just had jokes and laughs. I have phoned, I don't even know if I should be saying this because poor Dr. Kesari, he's phoned me at 4 a.m. He's just been astonishing. And the PAs, Judy and Min, I don't even know if they're still there, but as I say, I wish I'd known you, were beyond helpful, warm, wonderful, because I was, I of course was an advocate for my husband, and I probably terrorized them at times because I was the one that had to do that. My daughters couldn't really do that. So I was phoning all the time. I mean, Stephen was, it did look very positive for a while. And we tried to stay positive, but then there'd be something else happen. And then in the last year and a half, it was the problems accelerated and the feeding tube's broken and he's throwing up or whatever. I mean, I won't go into the kind of horrific details, but they were calm, they were helpful, they were wonderful. They phone me back all the time. I've had people coming to the house, like old-fashioned house calls. Dr. Kesari, by the way, came to our memorial, our celebration of life for Stephen. It's beyond belief. I am forever grateful, and it gave me hope and kept us positive. And Stephen, like Ari, like your dad, was hopeful. He was positive. He never ever complained. But really, just to go back to your question, the whole staff at P&I and St. John's were extraordinary. And I just want to mention not only people like you, the highly qualified people like you, but is it John at the Cancer Centre desk? Where's Steve? I've been in to see him since then. He was just amazing. Amin, who's the chief security guy who I've written about for Thrive and talked about, was amazing. The staff, it's really amazing. And as I said, I grew up Jewish and I'm now in a spiritual organization called MSIA where Steve worked. But going in there and feeling the love, it felt hopeful, it felt spiritual. And I lived in that hospital for several sessions of weeks at a time because I wouldn't leave, my older daughter and I, well, all three, my two daughters really, we refused to leave him at any time. and especially when he couldn't speak. So we were always there with him. And the atmosphere there was uplifting. I know there is a spiritual focus. It's not the religion I grew up with, but just extraordinary. So that I felt actually joyful when I was there, even when Stephen was going through such difficult, painful, terrible, in some ways, thing. I don't even want to call it terrible, challenging moments, weeks, months. Amazing.
Ari, is that your experience?
It's exactly my experience, and I would definitely mirror everything Elaine is saying. I think it has the willingness of the physicians to just go above and beyond, and the PAs and all of the ancillary staff there have made a really difficult process definitely a lot easier. There's no doubt in my mind that if I need something, it will be taken care of on so many levels. So that part has actually been the easiest part of all of this. Is once we got plugged in there and we started out elsewhere and we came to PNI eventually. That part honestly couldn't be smoother. And I'll also comment that it's changed the way I practice. And I always, knew and considered myself to be a compassionate doctor, but this is a whole other level that I've learned through this process from them that I hope to be able to, that I hope I'm implementing in my own practice.
Wait, tell us about tell us what kind of doctor you are.
Yeah, I'm a gastroenterologist, stomach digestive system doctor, do a lot of, cancer prevention, cancer screening, ironically, for prevention of GI cancers and treating GI symptoms and things like that. So my patient population is not a terminally ill population. They're generally healthier and in prevention, but what it's done is up the level of compassion in my own practice and in my life in general, I would say. That, each moment, each interaction is precious and is the ability to make a difference. And to be honest, a lot of my patients come into the office now and they ask, "How's Dad?" And they coach me through it. And it's always, when you think about it, it's the other way around. The doctor's supposed to take care of the patient, but honestly, we'll sit there and talk about me for 5 or 10 minutes. And it's astonishing. It's the show of compassion is just, it's breathtaking.
God. So there's one of the questions here that we have on our list is, what do you wish the medical system understood? And what I'm taking away from what you've said is there's a lot that it does understand. Is there anything that you think, having gone through this, that the system could do better? Elaine?
Yes. Well, it's a complicated question because I grew up with the NHS, the National Health Service in Britain, which is socialized medicine, and where you would get support with a care package at home. And I think there are two main things that strike me. And the first is that, so this is no fault of PNI or St. John's, that the complications and the difficulties for a caregiver are immense when you're going through dealing with brain cancer. And I didn't really get enough support in sorting out a home care package and any.
What does that mean? What does that mean in the British?
Well, you get help with
home care.
Caregivers. They wouldn't let you go home without support, without care, and then you get regular care. But it's here we do get home health, but that is so little, and it's not the kind of full-on care that you need. So I can't speak it really in a knowledgeable way about Britain because I've lived here for over 30 years.
But that's generally
I'm American citizen. But what we didn't get was support. Well, we did individually from Dr. Casey, Dr. Carrillo, Dr. Wagley, from all people like you. I'm like, that was amazing, but there was no concerted effort to get us care that would be paid for. And yet it seems crazy to me because we would not let Stephen go into assisted living, into a care home, a nursing home, we wanted him at home, which was much more economical, much cheaper than having him go into a nursing home. And yet there was no financial assistance for us at all because, I have a mortgage, I have a house, I have a job. And so I was having to sort all that out on my own and pay for the caregivers, which was very expensive. And we didn't have long-term disability or anything. Of course, you never think this is going to happen to you. That's one thing I might recommend people to do if they can afford it in hindsight. And so it's just been a massive expense. And, I'm happy to have done it and that I could do it and get through that with support from people around, from friends and my community and a GoFundMe and my own career. But I just think that's one big thing, of the financial aspect and the fact that I don't understand. So, for instance, just give one example. Steve had to have several courses of IV antibiotics for extremely serious infections. We had to sort that out ourselves and pay a lot for them. And yet, had he been in hospital, so had we admitted him yet again to the ER, I don't know how many times we had to do that, because I'm just going to say several times during the time that Steve was ill because of emergencies. But we would have got that free had he been at St. John's. That wouldn't have been a cost to us. But we ended up paying thousands in courses of antibiotics and just really simple things like incontinence pads. We had to pay for hundreds of dollars. And I mean, it became a joke. Honestly, that was another thing. We had to see the humor all the time, actually, in the situations, Steve included. But I think the complications and this happens to you. And I'm sure Ari knew a lot more than I did. I knew, actually, my dad was a doctor who died soon after Steve in England, and my brother's a doctor, but I knew nothing about any of this, even though I'd done a lot of health reporting as a journalist over the years. Nothing can prepare you for this. And I didn't have, there are nurse navigators. We also moved to St. John's from somewhere else very soon after Stephen's first surgery. In fact, a month after he was diagnosed, we moved to P&I in St. John's. But it would be great to have one person, really as a point person guiding you through the process. And I know that would be very expensive. It'd be really hard to do. But I was just lost, and then all the paperwork and the MyChart stuff and the bills and then fighting the bills. One of the things that I shouldn't have had to deal with, I feel like, was that Stephen, for the past year and a half, had to get private ambulances because we couldn't get him in the car anymore. And long after he died, I was still getting bills from the company, thousands of dollars for the 6-minute ride from our house in Santa Monica to St. John's. And so I don't want to complain too much about that, but that shouldn't happen. But I didn't really have enough assistance and support, because who has time to help? Yeah. And yet those things, it's those little stressors that add up. Just, every time you open a bill or, go online and see another bill, it's like, my heart would sink. And
that's medicine in America. I mean, so Ari, does that sound familiar?
It does. It does sound familiar. It's definitely difficult. I'd say the hardest thing was to try to get good, reliable, full-time, home care, so as to ease a lot of the burden of a lot of the family members, and also for Dad's sense of dignity. There comes a time where your faculties are really diminished, and your family members are having to do things for you that you could never have imagined that they'd have to do for you. And as Elaine said, they do it willingly, they do it with love. But on both sides, it's important to have people there to help get you through that, because it weighs on you on both sides, for the patient and for the caregiver. It was difficult to find somebody. We were extremely blessed to have found somebody that was honestly, almost like Dad's voice when he couldn't speak, an extremely positive, happy caregiver. His name is Edgar, and he's part of the family now. I can't even imagine not having him around. He plays guitar for us. He sings. We do karaoke. He knows my kids. He's part of the family. He tries to go home, and we make sure that he goes home with a full plate. And even though he never will go with the full plate, Mom's throwing a full plate at him on the way out, and he's just part of us. But all that to say that it's just difficult to find good care. We really went through so many people, and it was extremely stressful. So that was difficult. And the other thing that was extremely difficult is that with something like glioblastoma, Elaine mentioned that, maybe I knew kind of what I was getting into. And that was a blessing and a curse. I kind of knew in the ER when we saw that MRI it was a CT scan. I knew what we were getting into right there and then. There was no hiding, and there was no tiptoeing around that. And then from there, and I experienced this as well as a physician, is the blend of Western medicine, what's available, and then the holistic. It is endless how many treatments are out there. And it is so difficult to have a filter of what to do. And when you get diagnosed, you're in the hospital, there's a brain tumor, you feel a sense of urgency to have this taken out. I think Dad had surgery 5 days after. In hindsight, I think that we shouldn't have had such urgency. I think maybe we had more time than we thought to do some research and homework, and thankfully, luckily, unfortunately, not everybody has this, but we had the facilities and the means maybe to go anywhere in the country or the world to try to get that done in a slower manner. But then I was left, and I to research everything, holistic, non-holistic. I mean, we had Dad. We still do on CBD therapy. So I have a CBD specialist. We tried all kinds of, dietitians and nutritionists, and researching different things in different countries. Somebody even, like, I'll tell you, the wildest, most extreme versions of it is somebody was cured of glioblastoma by finding snails in the garden and blending them up and drinking. I mean, you name it, I've heard of what it is. And then you're left as the caretaker, and then put on top of it the son who's a doctor caretaker to filter all this out. Yeah. And some of the stuff you actually do it'll kill you. And it's just extremely difficult. And there's no data, there's no research. There's on a lot of this stuff. It's very somebody tried it and it worked type of thing, and you feel desperate. So you consider doing anything. Snails in the garden, sure.
Did you try the snails in the garden?
No, absolutely not. I'm a gastroenterologist. You get a disease from that. No way.
Right.
Yeah, can I just add there, Ari? Yeah, I mean, we went through all that as well and spent a lot of money. Because there was a guy called Bobby who was another patient of Dr. Kayseri, and Dr. Kayseri isn't against holistic medicine, and he said, try everything. So we had this guy Bobby who had a glioblastoma. He did live for 4 years actually, and he was so helpful to us as a resource. But we kind of had Zooms with his homeopathic doctor in Hawaii he'd been to. He was a very wealthy guy, and I was getting supplements, all kinds of supplements, like different mushroom supplements and lion's mane and all sorts of things that were supposed to help. And then we read about jellyfish. There was some kind of and you're desperate and clutch at straws. But I have to say so all that is very hard to navigate, because how do you know? And I know you did know a lot more than me. But I also have friends who've been brain cancer researchers. I've got a friend at U Michigan, and I'd forgotten that's what she did. And so she was talking to Dr. Kayseri for me and helping me. And it's just, I don't know what the answer would be to navigate all that, whether you have funds or not. But I did find that very complex, difficult, confusing. But what really helped for me was the spiritual outlook, that just like prayer, having some kind of faith that we would get through this, that this somehow was for Steve's and our highest good, and that he would be going on somewhere better, and that that we would all find peace and there was a meaning in it. So maybe, you know, cynics would say, of course you'd say that. But I have found that very, very helpful, having a spiritual outlook, spiritual perspective.
And now a message from our sponsor. The Think Neuro podcast is brought to you by Pacific Neuroscience Institute Foundation, a nonprofit 501c3 organization. If you're inspired by what you hear and wish to support our mission of education through innovation, please visit pacificneuro.org/foundation. Emmeline, what do you have to say about the home care conundrum? And then also any advice on sorting through these treatment options, you know, as alternative as they may be?
Yeah, I hear it. I hear that frustration. And I think we all echo with it. I think we all butt heads at the medical system at different parts. But I think consistently, what we feel is we always wish that we could do more. We wish we had more time in clinic with patients. We wish we could do more home interventions, because I do think it's important, if somebody wants to be at home more, to allow them to do that in a safe way and support the patient and their family's goals in doing that. So I hear that frustration. I'm so sorry to hear that it was such a challenge. I know that you're not the only one that's experienced that. As far as navigating it, I think, you know, not everybody has time, means, energy to do this, support to do this. So it does end up oftentimes going to family and friends who can search online and do everything you did, Elaine, and are what you're describing. Hopefully, my hope is that 5, 10, 20 years from now, this will be a much smoother process, and that we'll have learned from this. We'll advocated for our patients, everybody, family, caregivers, healthcare providers, to improve coverage for these services. As far as the supplements go and snails, yeah, I think one of the ways that I think we're all looking to have control over what feels like a really out of control situation. And one of the ways you can do that is to research. And you're right, Ari, if you do that, you can spend all day, every day, not sleep for years to read all this out there. But I try to meet patients' families where they're at when they want to try something. I think it's a way that you can exert control over a diagnosis, over a symptom. So as long as there's no, proven harm, I think that it's really important to be flexible and to allow the blending of different cultural beliefs, combination of different medicines, whether it be Western or more holistic, like you said, Ari. I think it's really important to allow people to feel control over these things and to give options, and not just say, I want you to do this, so you're going to do that. I think that's not the way good medicine works anymore. It's to allow options, talk through those options, and what makes the most sense for everybody in their unique situation. It's not a one size fits all for everybody. Absolutely not.
Well, and P&I is, I've talked to a number of doctors there now, many of them, and P&I is not, doesn't dismiss these other treatments or these other ideas. I mean, they're very open to them about, spirituality, meditation, all across the gamut, right? They ask for evidence, but I've noticed that trend there. I think the last thing we should talk about is, how did you take care of yourself as a caregiver? And I'm trying to imagine, I suspect you could feel guilty at times if you were taking care of yourself and not the patient. And maybe I'm off base there, but if you could talk a little bit about how you took care of yourself, I think that would be helpful. Elaine, do you want to lead off there?
Yes. I just first of all would like to say, one of the ways I took care of myself was by finding a wonderful caregiver, Anna, who we'd known and who'd actually worked for Stephen before he got sick as a cleaner. And it turned out that Anna Gonzalez was the most extraordinary caregiver. So she was with us throughout the whole time. And Ari, just as you were saying about your caregiver, she brought light, humor, joy, patience, and just love into our house. So she was there so much of the time. And that really helped me take care of myself because I trusted her. So if I wanted to go for a walk for an hour, I knew that Anna was there. She was organized, she was efficient. She knew what music, she knew that Steve liked, either Dylan or Muddy Waters or Rachmaninoff. She could play him the band. She knew to go on YouTube and do all that for him. And that actually really helped me as a caregiver. And then I just want to mention our other, caregiver, a friend, Joanna. So when Anna wasn't there, Joanna, who's a nurse, would fill in, but she didn't charge us nurses' rate. She was just really helping out as service. And so she would come in the evenings. And I'm mentioning that as part of my care because we'd have little dinners together. I'd put out olives and, we'd just chat. And it was really great for me to have somebody in the evening who, I could talk to. And it gave my daughters, it gave Chase, who's now 28, a chance to, take some time off as well. So the ways I took care of myself, first of all, I have the most amazing job with Thrive Global. Ariana Huffington founded the company, and it's a behavior change platform with a mission to end the burnout epidemic by focusing on well-being. And so it was just perfect for me. I'm the senior writer at the company, and it felt like to many people, well, what, you're working full time as well as caring for Steve and being up through the night. And it was great because I could do my job at home. I love my job. It's purposeful, meaningful. I interview people. As Ari was saying, I have much more compassion now than I ever did before. And it's just made me feel like a better writer and a better journalist. And that has been a big part of my self-care. Plus, I was making money so I could pay for our amazing caregivers and give Steve the best care possible and continue our lives. So that was one important part, my work. Second, it was just connecting with Steve in any way I could, because he did lose a lot of his faculties, but mentally he was always fine. So we'd listen to music together. He ended up not being able to eat, so I'd just have dinner and sit with him, and we'd watch. There was comedy, so we'd watch Ted Lasso or SNL, Saturday Night Live, and we'd have people round. It was like connection was really important, and I barely went out during those 3.5 years. Barely left our house in Santa Monica. But, there had been trips to England before, and I was working all over the world, but everything was contained in our house, our bedroom, our backyard. And so self-care for me was just being with Steve when he could always go out. My daughter, Chase, could wheel him outside, and so he could enjoy the sunshine and the flowers. That was really important. And self-care was moving, making sure I was eating well, just exercising, a lot of walking. I had a bicycle that Steve had put in on a kind of platform in our bedroom for me because I had knee problems years ago. So I just be on the bicycle, we'd put music on, listen to Dylan or whatever, Steve wanted, Van Morrison. And that was part of my self-care. And I had a big focus on gratitude. Just what am I grateful for? I'm grateful that Steve's alive. I'm grateful for our life together. I'm grateful for our amazing daughters, Chase and Ava Rose. I wrote a journal, and a lot of that was about gratitude, but just what I was going through. So I think that was very therapeutic. And gratitude for friends. And then I think underlying everything for me is self-care is having a spiritual practice. So I meditate every day. I continued to do that even if it was hard. And, I was like sobbing, and I just carried on with the meditation, going to online seminars, and just at the center of all my self-care really is this sense that there is more to life than this, and there is a deeper purpose, and that we're in this together. And, again, I think it all came down to gratitude to Dr. Kesari, Dr. Carrillo, Dr. Sharma, Dr. Wagley, all the staff at St. John's, and to my friends and family, and gratitude that I could afford to keep him at home, and for our beautiful house, and for all the love, and gratitude to myself that I managed, had the power within me to look on the bright side, have a sense of humor, be positive, and have fun with it. We always had a laugh. We had our friend Nancy. Yeah, one of the things that really helped me, actually, self-care, was Nancy, who'd been Steve's best friend at work. Every single Saturday night, except when we were in hospital and during COVID, she couldn't come and visit. She came around for dinner and I cooked. So I still did that. And I still do that right now. She still comes around every Saturday night. So, just having a strong community. The other thing I just want to mention, giving back. So even during that, I just didn't have much time to give back to anybody else, but did my best. Like, what can I do for a neighbor? Because I wanted to continue Steve's legacy of giving back. So I think all those elements are really important. And that's what I'd recommend to keep a kind of bright outlook and take care of ourselves.
Yeah. Ari.
Truth is, I'm still trying to figure that out. It's been a work in progress. Early on, it's changed shapes a lot, how this feels early on. Of course, there was a ton of anxiety that came on that I've never had in my life before. We've never experienced kind of difficult things. And over the course of a couple of years, we had a few family members, 2 aunts, pass away from cancer, and then Dad was diagnosed. So it really made me taste my own mortality, the anxiety, kind of what's to come. What's difficult about it, and then I'm going to lead into how I managed to promote self-care through all these challenges, what was difficult about it is, the world still goes on. Is my children still need me, my wife still needs me, my practice needs me. And God bless them all, because they're a huge part of the self-care and maintaining me and not letting the bottom fall out here. Also feeling like I need to be there for my mom, my sister, for my dad, making sure he's not in pain, that he's getting the best possible care. So a lot to balance, a lot to manage when something like this happens. But eventually, I came to a place, of realizing that a year passed, and then a little more passed. And I said, well, gosh, I wish I didn't waste the last year worrying about it, because I would have, enjoyed the time more. And I read something about anticipatory grieving, and that really stood out to me, that, and when Dad was younger, he told me stories about his dad about this. And there came a time where his mom had to tell the family about my grandfather, his dad, that, you'll mourn him when he dies, when he had rheumatoid heart disease before there was penicillin, because he was on his deathbed. And my grandma stood there and said, you'll grieve him when he dies. And the family just kind of like picked themselves up and stood up. And that hit me, is, when the time comes, as Elaine knows all too well, you'll do it. But I realized that you have to be in the moment. You have to keep it light. You have to keep it. When Elaine said it, I was thinking to myself, I don't know if the audience will understand what you meant when you said have fun with it. Like, how can you have fun with that? But you can, and there's ways that we wind up laughing in a difficult situation. And I remember Dad going into his brain surgery. But anyways, he had everybody dancing. The anesthesiologist, the nurses, he was dancing on his way to the OR.
Oh my gosh.
There's ways to stay happy when you have no business being happy. And there's ways to do it.
Can I just, if there's time, I know exactly what Ari's, of course, going through. And I'm, a different, maybe like easier stage. But I just know exactly what he's going through, but finding the joy in the most difficult situations is a key. Let Ari go, and I just know exactly.
Very sorry.
No, you're totally good here. Absolutely.
So the other part of it, like the self-care, like recognizing that I couldn't let everybody, kind of myself included, go into the tailspin was exercise was really my meditation. Like really every morning waking up at 6 a.m. and making sure before any phone calls, emails, making sure, dad's taken care of, that I was taking care of myself. And God bless my wife for kind of always making me realize that things can be worse. I've seen it through this process that even though this was bad, it's the best of the worst. And it actually could be worse. I've had friends who, have gone through some very traumatic things in the interim since dad's been diagnosed. And, you never know. You just have to stay positive. I think making sure that there were periods of time where I wasn't sleeping very well, and focusing on that a little bit more helped a lot. Writing things down instead of just kind of always ruminating about them helped a lot. And then just being around my kids and family and just feeling the love from everybody. And honestly,
wait, how old are your kids?
12 and 11.
Okay. And
Yeah.
does your father live close by?
He lives very close by. And in
That's
fact,
what I thought. I just wanted to clarify.
yeah, he lives close by. And when he fell and broke his hip, I had the privilege of having him in our home for 6 months. Him and mom lived with us, which was amazing. And, we've just managed to take care of each other. That's been the self-care.
What was his job?
He's had a lot of jobs, but dad started out in Iran before we moved here. We moved here when I was 4. He was in his early 30s. He did a lot of import export there, and then he came here and he sold sewing thread to the garment district in downtown LA.
Yeah.
Did real estate, a lot of charity work.
He was he could do it all.
A lot of different things. He absolutely could. Yeah.
Yeah. Sorry I interrupted you. I just wanted to get that there. Wow. So let's let Emmeline just weigh in here. And then I want to do one last thing. And I was going to ask if you all wanted to ask each other something, because you probably know the questions better than I do. So why don't we see if Emmeline wants to say anything about what she just heard? And then let's think of something. If there's something that you'd like to ask, I think we should do that.
It's a great question. What to ask each other? In regards to what we were just talking about, how to practice gratitude in the midst of terminal illness. And I think it's important to recognize that there's still life to live. There's still memories to be made and joy to be had. And I think believing that is true is the first part, because I think when you're presented with such horrific news, all the air gets sucked out of the room and you think, I will never be that happy again. I will never be that carefree again, because now this new person, this new role I have in my family, this is it. I will say that, plot twist, I'm also a caregiver. My father was diagnosed with cancer about a year and a half ago. And you just do. You wonder how the next day you get up, people are going to work and you're thinking how, because my life has completely changed. I was one person yesterday and today I'm this whole new person. And it takes a while. I think being patient with yourself to allow yourself to be able to laugh, to feel joy. I think you feel guilty at first. I felt guilty laughing or trying to have fun, because I felt like, I should maybe still be feeling some sadness. But it comes back, and it came back in a beautiful but different way for me. One way that I experience joy and practice gratitude and practice self-care is to be out in nature. I think to see, I just went to a couple gardens a couple weekends ago, and the tulips are blooming, the flowers are blooming. And I think it made me feel so grateful to have at least what I have right now, to have people that I love, people that love me. And I thought about what really matters today. What matters today? What do I have today? And I had enough. I had more than enough to make me feel grateful and whole and joyful.
Well, you've all seen this from different angles, right? I mean, right? Ari's a caregiver who's, now is in another role. You're in the same situation, right? And Elaine writes about this stuff and now is kind of living, right?
Yeah, I was just because I write about this stuff. So my articles are on Thrive, many articles that I've written about Steve, about caregiving, because it's been therapeutic for me, and also hopefully, or maybe inspiring or informative for other people. But there's one thing I just wanted to add about my experience, that so on the gratitude, two things. The gratitude, it's like, and Ari, you talked about the staying presence and appreciating the present moment, that all through this, I had my wonderful daughters, Chase and Ava Rose, who were there. They were there with us, for me and for Stephen, and just really a great gift. And that gave me a lot of joy and gave Stephen a lot of joy. The other thing I just wanted to say was, I have learned with great difficulty not to judge the experience of the person who is dying, and to see Stephen through a different lens, because on the face of it, towards the end, he spent most of his time lying on a hospital bed with wounds, with a tube. He couldn't eat, he couldn't drink, and he couldn't talk. And yet, mentally, he was fine. And I would say to him, do you still want to live? Because many people were suggesting hospice, and which I didn't want selfishly, but I knew that I needed to give Stephen that option. And I'd say, stick out your tongue if you want to live. And he'd stick out his tongue. And I'd say, stick out your tongue if you want to hospice and you want to end it all, really. If you want to just, which was an option for maybe the last year. And he didn't stick it out his tongue. And I used to check it. And then I'd say, okay, Dr. Casery, you check. And Santosh would check. And Steve wanted to live, even when, we were wheeling him in. And this is a strong, dynamic guy, man of action, who was reduced, you might say, to, this kind of figure who was lying there and couldn't do anything. And so what I learned was not to judge his experience, because I know, I can't prove it, but I know that Stephen was finding joy, with his family. So with me being there, with Chase and Ava around him, appreciating his family, hearing, that he couldn't go to Chase's college graduation at Kenyon, but he knew she got in to do a PhD. He knew that Chase became a TV reporter, and he saw her on TV. She's a TV news reporter for Spectrum here in LA. And he got a lot of joy out of just being with us, just lying there. And so I think it's maybe helpful for people to know that our experience of life and what we think are the prerequisites for a good life can change. And who knows how much more joy he got out of life in those last months and years. And what I really appreciate was that the team at P&I, led by Santosh, knew and appreciated that. And he agreed with me. He said, no, he wants to live. And he did. And, amazingly for Steve, who couldn't play tennis, couldn't play the guitar, couldn't go and do things for other people and fix everything around the house. And yet I know that there was a deep joy, and that he could be read to, and he could find things funny, and he could enjoy his family.
That reminds me, when Steve Jobs was on his deathbed with pancreatic cancer, he, at the end, he couldn't do any of these things. And he just, I think what was the quote is something like, he just was sitting there and just be like, wow. Like he really appreciated just life, even in that state. It was like a revelation for him, right? So let's do this. Elaine, do you have a question for either of these folks? Kind of a quick lightning round here.
A quick question. Well, yeah, Ari, what do you need most now? I feel like, is there anything I can offer to help at this stage? I'm on the next stage for me. What do you need most is what comes to mind.
It's honestly sentiments and questions like that really keep everybody going. So thank you for asking that. We're in that place. You couldn't have said it better, that joy is the barometer. I think that, Dad still has joy. I was on vacation with the kids the other week, and I was FaceTiming him and having a good time with the kids. And I hadn't heard him talk in a while, but I don't know how he got the words out, but he said it in Farsi that, he's happy to hear that. And it was incredible. And it changes things that you don't consider to be imaginable or a state which you could accept. Once you're in that state, it becomes the new norm, and the joy and the love is still at the base of it all. So, Elaine, to answer your question, we're good. I think we're good, but we just have to keep staying positive and present and, doing everything we can for each other. But I so appreciate you asking.
You're very inspiring, by the way.
Well, all of you are.
I feel the same about all of you, honestly.
Ari, what about you? What would you ask?
What I want to ask, I'm not going to ask, but I'll tell you what that question is. But I don't want Elaine to answer it because it's going to be different. Is that whole anxiety of just what happens next? Like, how do we get through the next stage? And if there's anything I've learned through these stages, it's you'll figure it out and you'll be together and you'll find out. But I would want to ask of Emmeline, are there, it's been a while since I've looked, maybe a couple of years. Do you foresee in the field big breakthroughs, big major game changers that could potentially come through for patients and kind of change the face of this for everybody in the future?
That's our hope. I look at the hardworking people in our research lab, all of us contributing to clinical research, and that is the goal. Now, I do not going into too much science. Obviously, brain tumors have a unique challenge in that your body, your blood vessels in your brain are so tight, they don't let a lot of drugs through. So it's really hard to make a medication that can treat a brain tumor. And B, it's part of the core of who you are. Your brain composes your personality, how you function. And I mean, I don't want to get into any other details, but it's tough. It's really tough to find.
It's a loaded question, but
It is.
I think it's one that if I think about it as a physician, I don't know anything about. The last time I heard about glioblastoma, honestly, was in medical school 20 years ago until Dad was diagnosed. So I know nothing about it. But I as I've looked into this, I think it will come. And I think that it's not far off, and that's not based on science or research or data, but I really truly think that in medicine in general, there seemed to be a better understanding of personalized individual things that I think there'll be a breakthrough at some point. And I think it's just important, whether we have the science or data, for people to recognize that as a possibility.
Yeah, I think we're definitely moving it away from the one size fits all model to more targeted therapies. And I think that's going to be the direction of the future, and how we can even use existing therapies for different cancers. I think that'll be part of it too, but you're right. It's always our hope that give us another month, give us another year. And I hope that we'll be looking at a different outcome for so many people.
Dr. Kayseri assured me that he is going to cure brain cancer. So that's a sweeping statement from a non-medic, as in me, but Dr. Kayseri says he will do it.
I've interviewed him, and he is a very capable person. I would be glad to have him. I'm glad to have him on the job. I mean,
I'm counting on him.
Yeah. Emmeline, what did I miss? You know this stuff cold. What did we not get here?
Oh, I think we had, I think we touched on so much. I've never met both of you before, so I'm learning your stories from you for the first time, and I appreciate your willingness to share and be so honest about your experiences. For me, a question that I have for both of you, it's something I typically ask. I don't always ask this question, but I'm wondering what parts of your loved ones do you see in yourself? What are parts of them that you look in the mirror and you're like, oh, that's my spouse, or that's my dad? I'm curious what that is for you both.
I'll take that one. First, if you don't mind, I certainly look like him. I wish I had a picture to show you, but there's a striking resemblance between us. And I think it's his positivity, his willingness to kind of stand in the middle and hold other people up. I like to think that I learned to be a good dad from him. Yeah, those would be the salient things.
That's good stuff.
Yeah.
It's amazing.
Yeah.
Yeah.
Elaine?
So the question is, how am I like him? So I'm going to say, so first of all, am I pointing this at the camera? This is Steve and me a few years ago. I've got pictures of him all over.
Was he British or American?
American, Philadelphia.
Yeah.
And I'm just going to take this one off the wall because he's. This is Steve and Chase, our oldest one. He's a baby. Like, he was just gorgeous. He's like gorgeous.
They look so similar. You can tell. You can tell they're related.
So I think I had honestly not very much in common with Steve, other than we both in the same kind of spiritual journey, and we both loved the same music and had a similar sense of humor. But what I'm going to say is what I have learned from Stephen since he got ill, and what I am doing to embody his presence and legacy since he died, are just huge. So he's laughing up there or wherever, because I know he's with us here. I've learned to I was the cook, always the cook, but he did the everything at home. I've learned to do the laundry properly. I've learned to do the fine details when I'm cleaning. I've learned to be more organized. But most of all, the real legacy of Stephen Beach is that he just was a giver. He had the most kindness and compassion and quiet sense of service I've ever met in my life. And everybody says this about him. It's who he was intrinsically. He was a man of service. And so I've just learned to help somebody if I see them carrying a heavy bag. I've learned to smile in Trader Joe's and thank people. I've learned to care about my neighbors and the community, and just together with my daughters, we've all said this, that we've just learned to be more compassionate human beings. And I think I didn't have that as much as Steve did at all. And that has become maybe the most important and significant part of how I've dealt with Steve's death and the way I want to live my life.
Beautiful.
Wow. This has been tremendous. I've got a mental list of all the profound things I've heard from all three of you about this. And it's long and so compelling. And I can't thank you enough for sharing your stories here. I think it's going to be very useful for people. So Elaine, Ari, and Emmeline, thank you so much.
Thank you so much. Thank you.
Thank you so
You've
much for
been
having us.
wonderful, Anthony.
Oh, no, you guys, geez.